All right, well, let's stick on mitochondria. What about other supplements, different hacks that we can use to upgrade them in a similar way?
Yeah, I start with that little metal. Mitochondria is it is dependent on the metal called magnesium, and everybody's low on this. I mean, again, go back to our ancestors 1,000 years ago saying, guess what? Your magnesium, this should be consumed in the foods that we eat. But our soil and even our beef, any place we get magnesium is so depleted that, the list of symptoms that magnesium, you point in the direction, I'm like, it's magnesium until proven otherwise. Especially that low energy, that poor sleep, that mitochondria cannot do its job. It cannot, think of magnesium as, a spark plug. It's the plug that gets the spark to go and make that mitochondria do its job. And without proper magnesium, it just can't do it. It cannot turn that fuel into energy. And, I have a few things where I don't spend money on checking their magnesium anymore. I mean, it is such a symptom-based profile that don't waste your time and your money having me be some kind of, magnesium god. Google the list. And if that's you, the first place I send them is a float tank. So, what's really actually, I had a few patients do this, is they go into Chat GPT and say, what's the closest magnesium float near me? And Google and ChatGPT does a pretty good job of finding it. And better than anything else we found. Have you ever been to one?
Well, you actually were texting with me. I was having an issue where my legs were restless at night. Mm-hmm. I've been lowering my carbs gradually over the last 6 months, last year, and I was having an issue with this. I texted you and you told me about this. So explain what was happening in my case where that was coming on related to magnesium, and then you can bring in the float tank.
Yes. So restless leg is this, it's awful. How long did you suffer with it before you texted me?
Probably a couple of months on and off.
Right. And it's a weird thing at first. You're like, if your spouse is like, I don't know, you're kicking your legs at night and they'll move them and it's like twitching, but it's also like a cramping and it'll wake them right out of sleep. It'll, bother the partner in bed. And that movement is a glitch that should not be happening. And it is almost always a nutrient deficiency of a metal. And the two top metals that cause restless leg are magnesium for the first 8 and then iron for the next 4. I mean, it's just like, it is a metal missing from that person. And I vote for magnesium every time. Not that iron deficiency doesn't cause this as well, but that restless leg it'll keep their brain from sleeping. It gets them irritable. That there is discipline in, cutting 20 total carbs down. But when you sleep deprive them and they've got this twitchiness in their sleep and their legs don't feel good the next day, boy, they can't say no to that Dorito. Boom, it's in their mouth before they knew it. So watching, and we can give them medication. Like there's some very great Parkinson medication that stops the movement. But I contend that, again, that's option number 20. When the first 10 were go get the magnesium in you, I promise you most of this is reversible. And if that's happening in your legs, I guarantee that what's happening in your brain isn't pretty. They get anxious. The thoughts will flight and they're like, it's not like me. I don't do this. And it really, God, if you're raising kids, you're like, I'm the ADHD teenager all of a sudden. Why can I not focus? And then you say, all right, just trust me on this. Go get in a float tank. So I have folks Google, the Dead Sea. And you see, usually you can find these old-fashioned pictures of the ladies in their bathing suits and they're floating and they're hanging out in the Dead Sea. And you'll say, this is this secret to life. All your problems are solved if you go to the Dead Sea and you hang out for an afternoon. And they're floating in that salt water in that Dead Sea because the salinity or the salt concentration is so dense that it displaces the human at the top of the water. And of course, it's called the Dead Sea because nothing grows in there. High magnesium is deadly to most plants and animals. So it might smell funny, but it's You're like, okay, this is a great tradition that shows how have we always replaced magnesium in these places, and why is there this mystical, like life just got better if you go to the Dead Sea and hang out for a week? Well, same thing happens if you schedule a float, and I say, in 21 days, get there 5 times. And what you're looking for is magnesium, that metal, can be absorbed through the skin. Now, your skin is a great protector, and there's a lot of things that do not come through the skin, but magnesium comes through the skin. And I've had patients so depleted in magnesium that when I sent them to the float, they couldn't make it all the way through the float. They had to run to the bathroom. Because the other place that we use magnesium in medicine is as a laxative. If you put too much down the gullet at once, I'm going to send you trotting to the toilet. And it's great if you're constipated, or if, and it's used, 7-Eleven around here, you can find it at it's in the laxative aisle. But that means it went out, it did not get absorbed. When you look at really depleted patients, they won't make it 20 minutes in that float tank. Now, just listen to the lifespan of what that magnesium needed to do. The magnesium was in the water. It gets absorbed through the skin. It gets into the circulation. It goes to their GI system, and then it leaks backwards into their bowel enough to cause them to go to the bathroom. I mean, the imagery in my mind is, that patient is in such trouble. I mean, if you're leaking magnesium backwards within 15 minutes of laying in that float tank, we got some work to do. And of course I say, give me 5 hours of hanging out in that float tank over a 21-day period. And it is miraculous. There are so many things that go backwards that they fix because they restore that magnesium deficiency. And, the treatment plan for restless leg, isn't cheap. They're Parkinsonian drugs that are manipulating the basal ganglial cells. And that's great if you have Parkinson's. But if you start on a Parkinsonian medicine in your mid-40s because really you were depleted of magnesium and you just use this medicine to make you feel better, well, that's not a very good job as your physician.
Well, my legs are a lot better now. I used a combo of oral magnesium spray, and the float tank. I noticed the biggest difference with the float tank, so.
It's crazy. The first time I heard about this, I thought, oh, this is woo-woo. But it wasn't. I was like, oh. And then I was quickly reminded by one of my OB-GYN friends that, how we get muscles to stop cramping when you're in labor is we put a magnesium drip in, and that uterus will shut off. If you ever have when your wife was pregnant, did she have any preterm labor?
No.
If you've ever seen preterm labor and they have to go to the hospital for an IV drip, the IV they're getting is magnesium. And my OB-GYN friends would say, yep, we discharge them from the hospital and we set the timer because it's a math formula for how long it'll take for that magnesium to either go in their bones and then slowly deplete again until that muscle starts cramping again and she goes back into preterm labor.
Do you find when you're working with people that it's usually people that are bringing the carbs down early on in the journey that experience this, or if they're dropping them down significantly, again, say by another, 100 grams, if they're only doing this in blocks, when they're really making those drops, is that when this happens?
Yeah, it's the diuresis that's associated with a ketogenic state. So if they drop their carbs from, let's say, 200 to 100, but that wasn't enough to lower the insulin to cause a diuresis. Diuresis means an increased blood supply goes through the kidney and you offload that into your urine, so they pee more. That, kind of think of it as wringing out the body with the excess inflammation, which is what you want. That's part of why a ketogenic diet is so linked to a healthier life. But if they drop that carbs from 200 to 100 and the blood supply to the kidney doesn't change much, well, you lose the magnesium with the increased blood supply, with the increased filtration through the kidney. So when I go from 100 to 20 and they are in a strong ketogenic state, I'm like, put some magnesium in or you're not going to like me very much. You have to replace the magnesium. When I fast, magnesium is something I try to take most days. And on my fasting days, I'll just take 2 because That's how you stay out of the ditch. If I go through a season of not doing that, my feet will cramp in the middle of the night. And you're like, oh shoot, I'm human and I got to follow my own rules.
Do you find for yourself or somebody that's been through the salt baths that when they want to just maintain after that point, they can do it orally?
Yeah, the oral, I mean, here's how I try to equate it too is like one of the best absorption ones is that L-theanine, also getting past that blood-brain barrier, so really good penetration to the tissues, the end organ tissues. But I tell them it's like a float tank is worth like 2 bottles of that L-theanine. So it's a lot. You get a lot put in the body with that. So that's why I say, just trust me on this. 5 over 21 days gets you so far away from the edge. When they're cramping, when they have restless leg, I mean, I'll get them a little better. Then they'll go on with their life and say, no, you got to keep magnesium in your body. When we get 5 floats, at least I get them some grace where you can say, all right, now let's get you something that doesn't make you go diarrhea. And L-theanine is not cheap. I mean, so the supplements are also part of it. When I look at oral replacement, I almost discourage it as the way to get health, to get that back in your system, because they're like 6 bottles of that away before they really get to a safe place that they're not having most days of the week. Why is your brain doing that? Why is that concentration off? Why does that depression haunt them? Why is that anxiety? I mean, all of these symptoms, I want to just write them off as magnesium. And it is true. Most of them are improved when that's replaced. So I'm like, just quit farting around. Go get the magnesium replaced. And then we can look truly at what your symptoms are that are left. So the maintenance of it, yeah, take a supplement, but don't do it until you really see those symptoms improve with enough soaks in that magnesium. Absolutely.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Your physician is never going to care this much. They're not going to study you this much. You have to study you this much. That morning fasting blood sugar, when it only gets to 95 in the morning, you got problems. That's not normal. Yes.